We are going to, by common request of many of my subscribers, a lot of questions on donor area management, how to safeguard the integrity of the donor to prevent over harvesting so that grafts are available for future use in case the baldness progresses further. So as we all know, the donor area is finite. It is not limitless. So there is only a fixed number of grafts that can be harvested in a lifetime. So it becomes a duty as a doctor to preserve the donor for future availability of grafts so that the aims and objectives that we have while starting off hair restoration are met in the lifetime, are met in future sessions as well when baldness progresses, not only in this first instant, because baldness is ever progressive, as we all know. It has not yet fully evolved, especially if you are a youngster. So going on to the first question, what exactly is the donor area of hair transplant? Well, the donor area of hair transplant, the traditional donor area of the hair transplant is one at the back of the head and the sides. The area where you get maximum grafts in the anagen phase. The area where the hair are relatively DHT resistant. And this is called as the safe zone or the permanent zone. And it stretches from both the ears, going all the way to the back, staying short of the crown area, and not going down to the nape of the neck. This is the area where you get healthy, resilient for hair follicles that can withstand the test of time and can last a lifetime. This area is critical because it supplies the graft availability for a long time. And if we overharvest this area, if we go beyond the bounds of the safe zone, it is going to affect firstly our hair transplant presently, and secondly the hair that have been transplanted, if the hair have been harvested are involved in the process of baldness, will usually fall off as baldness progresses, as these zones from where the grafts have been harvested are not permanent zones. So with the FUE, we have stretched the boundaries of the availability of the scalp donor. Earlier, the scalp donor was only available from the donor was only available in the scalp donor, but now, using FUE technique, we can harvest grafts from certain areas. The most common alternative area is the shadow area of the beard. In fair skin, we can also harvest from the cheeks because there is very little chance of leaving scars which are hypopigmented. And then if you have terminal hair, we can also explore the chest, the belly, the limbs. But very few people have terminal hair. It's only vellus hair in these locations. So we restrict ourselves in most cases to the scalp donor, number one. Number two, we restrict ourselves to the beard donor, and in Indian skin from the shadow area of the beard. And at times when the chest hair is lush, we can harvest from the beard, from the chest. And do not get away with this impression that body hair is an alternative to scalp hair. Scalp hair is very different in texture from body hair, and therefore if we are using body hair, we need to have body hair and scalp hair in the ratio of 1:4. Because if we exceed this ratio, it's going to look little off. It's not going to look natural. It's not going to look like natural hair that we have over the head. So this brings us to the next question: is the scalp donor permanent? See, nothing in this body is permanent. We are all impermanent beings on earth. So as we age, every cell in the body will undergo a process of senescence. It deteriorates over time. And the same is the case with the scalp donor. The same is the case with transplanted hair. They will continue to deteriorate. However, if the grafts have been taken from the donor zone, which is safe, which is permanent, the grafts will not fall off for a very long time till you are 60, 65, 70. They might thin because of a different process, or they might thin because the baldness is now involving the donor area as well, but they usually do not fall off if due diligence has been paid to the safety of the donor zone. So, are the grafts that are harvested from the donor area permanent? No, they are not permanent. They are relatively permanent. Every hair on the head, whether you are suffering from male pattern baldness or you're not suffering from male pattern baldness, will have some amount of susceptibility to DHT. However, this is a lot in patients who have extensive baldness. So when we harvest grafts in a case of extensive baldness from a relatively permanent area in the scalp, and we transplant it to the recipient area which is bald or thinning, these hair are susceptible during the growing phase of first 3 months or 4 months to the onslaught of DHT, which impedes its growth. So therefore in this period, even if the baldness is not progressing, even if we have exerted due diligence while harvesting from the safe zone, still you need the cover of a DHT blocker for first 6 months after hair transplant. So do not get away from with the belief that the donor area is permanent. Well, this sort of myth is spread by clinics who want to make the hair transplant process very simplistic. But patients who are suffering from hair loss, especially at a young age, are a gullible lot. The most intelligent hair loss sufferer is very gullible because he's emotionally devastated because of hair loss. And this makes him very gullible to he will hang on to even a straw to survive his hair loss. So that is the problem with hair loss sufferers, that anybody showing them a little bit of giving them a little bit of promise, they fall for it head over heels. So do your research properly before you get into a hair transplant. So next we go on to the third question: how many hair follicles can be harvested from the donor area? Well, the whole head has about 100,000 hair follicles, and the donor area has about 20,000 hair follicles. Now, by the term hair follicles, what I mean is that these are hair, single hair. Every graft contains about 2.5 average follicles per graft. So if there's 20,000, you divide it by 2.5 and you get the number of 8. But it's not 8,000 grafts that an average person with extensive baldness is going to get. As you bald, so does the donor area deteriorate. So I would say that an average person with an average donor area with extensive baldness has about 5,500 to 6,000 grafts available over multiple sessions, 6 months apart from his scalp donor. But if the donor area is lush, your baldness is not very extensive, that means the donor area is large in size, then up to 8,000 grafts can be, in the best of cases, harvested from the scalp donor, not in one session, but over several sessions, not exceeding the ratio, the golden harvesting ratio of 1:5, and spreading the donor area all over between both the ears of the back and the sides of the head. So other factors like hair density, scalp laxity, and the patient's individual characteristics also determines the number of grafts that are available. At any given time, you cannot harvest more than 1:5 golden ratio, because then you're going on to over harvesting. Also remember that in a lifetime we cannot harvest more than 50% of the follicles at the back of the head, because if we do, there will be visible thinning, which may look very unaesthetic, unpleasing to the eye. The next question is, what happens if too many follicles are harvested from the donor area? Well, over harvesting results if you exceed the ratio of 1:5, and this may give rise to the moth-eater appearance because you're concentrating the harvesting to a small area. And in yesterday's video, I have shown certain pictures of how this area looks, how devastating it could be, and how unforgiving the scalp donor is in such cases. So the scalp donor will look patchy, it will look thin and unappealing. Also, this creates a problem for future use of scalp donors because it can cause less availability of grafts for future use, because a lot of grafts will be lost in the process of permanent shock loss. So this is a very thin balance between harvesting adequate number of grafts to give coverage in this session for which the patient has come, and at the same time not damaging the donor area, allowing grafts to be available for future use as baldness progresses. So maintaining the integrity, the health of the scalp donor is of vital importance when you go on to this path of surgical hair restoration. So what is overharvesting and why is it a problem? So overharvesting is when you exceed the ratio of 1:5 harvesting from the scalp donor during the hair transplant. And this usually happens due to the greed both of the part of the patient and the part of the doctor in exceeding the legitimate number of grafts that can be harvested in one session. The patient is greedy because he wants to get more grafts in one session. He probably has traveled from abroad and he is weighing in the cost of travel, cost of stay, so he wants to get over with in one session, which happens in patients who are not researched properly. It also happens in doctors. The doctors are very well researched. If he's doing hair transplant, he knows that he's exceeding the limit. But in these cases, in cases which are hungry for revenue generation, and it happens in franchise clinics many a times, in non-doctor run clinics when doctor is only an employee in the clinic, he is often pressurized to earn more and more revenue, and he is likely to harvest more grafts than can be legitimately harvested from that scalp donor. So throwing caution to the winds, the future of such patients is very bleak, because as baldness progresses, you have killed the donor, you have killed the goose that lays the golden eggs, and you are at your wit's end how to get grafts, because the grafts are not available in the scalp donor and the scalp donor is looking so ugly. Next question is, how can overharvesting be avoided during hair transplant? So a skilled surgeon distributes the process of harvesting from the scalp donor evenly between the ear to ear on the back and the sides of the head. He does not cross the golden ratio of 1:5 during harvest. He uses high magnification to prevent damage, to prevent scarring, which can cause shock loss. He also uses good equipment, the punch does not wobble, and the punch does not cause excessive heat. The grafts do not get killed by excessive heat. So these are the reasons why the donor area gets damaged. Also, the punch size should not exceed 0.9 millimeters in diameter, because the higher the punch size, the more the scar tissue you're leaving behind. More damage and cutting off the blood supply of intervening follicles between harvesting sites happens, and these grafts die off. It could be a temporary shock loss, but more often than not, when you are throwing caution to the wind, it is a permanent shock loss. So this you have to be very careful about. Choose the clinic which uses magnification. Choose the clinic which holds the patient's safety first and revenue next. What is shock loss and how does it affect the donor area? So shock loss refers to temporary or permanent hair loss that occurs around the donor area due to surgical trauma. It can result from the extraction process or from damage to the surrounding follicles. While temporary shock loss will come back within 4 to 6 months, permanent shock loss is there for future. These hair will not come back, and these hair are such a huge waste when you lose these hair, because the donor area is finite. It does not replicate itself. It does not multiply. The hair are only 5,500 grafts to 6,000 at the most available in a lifetime. If you damage the donor area, you are damaging your future uh, mm, uh, goals and objectives to maintain a head full of hair for the rest of your life. So next question is, can the scars from hair transplants be visible and how are they managed? Yes, some scarring is always inevitable. Some scarring will always be there, because even if you take a blood sample from your skin, that scar will remain. But it is how minimal that scarring is, that it is not seen by the untrained eye. That is the principle on which hair transplant is done. We cannot escape scarring, but the scarring has to be minimal and not seen by the naked eye. A normal person should not be able to make out scarring of hair transplant either in the donor area or the recipient area. Scarring happens both in FUE and FUT equally well. Bad hair transplants, bad donor areas, bad hair transplant results are seen in both these techniques if done improperly. Scars also happen because you use high punch size, as I explained earlier. If you use low magnification while harvesting, and if you use equipment which is bad, equipment which causes burns, this can cause scarring in a different mechanism altogether. So how can patients ensure their donor area remains healthy for future hair transplants? So patients can play an active role by first discussing their goals and objectives with the doctor, and not being unrealistic in their expectations, believing in what the doctor says, provided you have chosen the clinic properly, believing in what the doctor says, not being greedy about grafts. Also, stopping smoking during the healing process, aiding healing by proper nutrition, proper lifestyle, cooperating with the patients, with the doctor's post-operative care, his instructions that he's given you. And a proper pre-operative counseling before the hair transplant. Don't rush into hair transplant, understand the process, and do diligent research before getting into this process of hair transplant. So what happens if the donor area is insufficient for future hair transplants? See, if the donor area is over-harvested, there is no chance that you will get enough grafts as your baldness progresses, especially if you are extensive bald, and if you are young in age and there is plenty of more scope for the baldness to spread. There is very little option left, because new areas of the baldness will not only get covered by body hair. Body hair are only there to fortify the density or available through scalp hair transplant. We cannot use body hair in isolation, unless of course you're going to keep your head shaved off, then why get a hair transplant done? These body hair do not blend well with the rest of the hair in the scalp. So they look at times very weird because they are unruly, especially beard hair can be very, very wiry and coarse. So this may leave only two options. One is to shave your head and get an SMP done, scalp micropigmentation. And the other one is to use a hair wig or a hair system. But mind you, if your donor area is looking bad and it is over harvested, the hair system, hair wig is not an option at all, because the hair wig does not cover the donor area. And last question is, why is it important to manage donor area strategically? Well, managing the donor area strategically is essential for long-term success in hair transplant. Preserving enough hair follicles for future sessions ensures that the patient can continue to address baldness as it evolves with time. So effective management of the donor area is as good, as important as achieving good coverage after hair transplant. So that was the live session for the day. If you have any questions for the next session, do let me know. We are almost every day having live sessions, and it all depends upon what questions you ask and how often you ask them. And I'm happy to answer the questions that you have in your mind, questions you've not been able to address seeing my videos or other videos on this platform. So let me know. Those of you who haven't subscribed, please do. Your commitment to the channel, your interest keeps the channel going. Have a nice day and God bless you.